Hello, everyone, and welcome to Closing the Gender Health Gap. I know we have a bunch of folks just starting to log on, so I will do some brief introductions and some of the administrative pieces here before we jump in. I am so excited about this panel, and I can't wait to kick it off. Before we get going, just a quick reminder that you do get $50 off Chronic Boss membership. So that would bring your membership to $397 annually for the entire year. If you have enjoyed this content, this is exactly the type of content that we're sharing in our collective, and also so many great opportunities for connection and networking. It's been amazing to watch all of you throughout this summit in the chats on Zoom and then in Circle. So thank you all for showing up and engaging. We're so thrilled to have you. I'm also so thrilled about the panelists that we have with us today. And I'd also like to acknowledge that they have generously donated some awesome giveaways for us. So anyone who's attending live, you're going to get a discount code for both WellTheory and for Evvy, and we'll talk a little bit more about that at the end. But for now, I'm going to invite our panelists, and I may need to make them co-hosts so that they can. Oh, Katie, I've just made you the host. Hi, Katie. Welcome. Good to see you. And let me just, I'm going to reclaim host so that I think sometimes people can't.
Yeah, it's saying that I can't start my video because the host has stopped it.
Yeah, I don't know why it does that. So I'm making you a co-host now. Okay, perfect. All right. Hi, Ellen. Hi, Priyanka. Hi, Katie. Thank you so much for being here.
Thank you for having us.
Yes, this is such an incredible trio of women on this call, and we have a lot to cover today, so I'm going to jump right in. The reason that we wanted to host this panel is because there's a need. We need to close the gender health gap. There's so much more that needs to be done in this space. And what's really exciting is that these three women on the call are really leading the charge in this space. And of course, for those of us who are living with chronic conditions, this is a critical issue. And there's been a lot of exciting movement in the past, actually just in the past couple of weeks on this issue. And so I'm going to have Katie, after everybody does introductions, she's going to give us a little bit of an overview on the state of women's health. But first, I'd like to ask our panelists just to give a quick overview on who you are, what brings you here, where you're calling in from, and then we'll dive in. So Ellen, I will start with you.
Awesome. Oh, well, thanks so much for having me, Lilly. Super excited to be here. I'm Ellen Rudolph, co-founder and CEO of WellTheory, based out of the Bay Area, so San Francisco, Bay Area born and raised. Just quick intro on me. So, I did my undergrad at Stanford, studied product design there, and got really interested in building digital products and experiences. So most of my career to date has been in the startup and tech world. Started off my career in a much different space than healthcare. I was one of the first product managers at Everlane, the e-commerce apparel company. And there, I think I really got a front row seat on how to build a strong consumer brand. And I think that's really been the through line of my career, which is working at companies that are trying to take more opaque industries like healthcare and make them more consumer first. So that led me to join Oscar Health, where I worked on the digital product side as well. But long story short, while I was at Oscar, I started to navigate this chronic health mystery that unfortunately left me totally bedridden when I was just 25. And I was experiencing a whole host of strange, debilitating symptoms, and basically went from doctor to doctor and got no answers. And, was in and out of the ER, urgent care. I'm sure this is a very familiar story for a lot of the folks online. But after a very long winding journey, learned I had an autoimmune disease. And I have a very vivid memory of going to see a doctor who basically said to me, come back once your symptoms get worse. Found it very hard to believe that there wasn't much within my control to change the trajectory of my disease, and fell down the PubMed rabbit hole and came across the impact of embracing more of an anti-inflammatory diet and lifestyle approach. And that changed the quality of my life. And I realized that I wasn't alone. There are 50 million Americans just like me suffering from autoimmune conditions. And I decided that I wanted to create the experience I wish I had earlier on in my own health journey. So that's a lot of what led to WellTheory.
Yeah, and I love what you're doing there, Ellen, and I can't wait to hear a bit more in a few minutes. Priyanka, I'd like to pass it over to you so that you can introduce yourself.
Amazing. Thank you so much again for having me. And I'm so excited that this space and conversation exists. I'm Priyanka. I'm the co-founder and CEO of Evvy. We're a women's health company that I'm sure we will talk lots more about later, but focused on the data and research gaps that exist within women's health. So a lot of the amazing things you'll hear from Katie about the gaps as they exist today and the amazing work that they are doing to help fund those gaps. We've taken a more tech and consumer first approach to accelerating that discovery. Which we will talk lots more about. And we'll get to talk about the vaginal microbiome, which is our first focus within that space. But personally, not so different story than what you heard from Ellen. I always joke, it's like I was a patient of the healthcare system as a person with a female body, like one too many times, and felt like no matter what doctors I went to or specialists, I was constantly told to drink more water or sleep more, or that maybe I had too stressful of a job. And I was just mind blown that specifically there wasn't data to help me understand what was going on in my body. And I remember when I was at the peak of one of my autoimmune flare-ups, I did like some crazy 17 tube blood draw panel. And my doctor called me and was like, you have the most perfect results I've seen in years. And I remember just being like, wow, okay, so basically we just have no idea what to measure in the female body. Because if you looked at me, you would not tell me that I was perfect, but apparently whatever we were trying to measure was not telling anyone what was right or wrong in my body. And that was when I found out that women weren't required to be, and I'm sure you'll hear lots more about this from Katie, or really even allowed to be in clinical research in the US until 1993, and that as women, we are diagnosed on average 4 years later than men across over 770 diseases. And so I became really interested in what the signals are that the female body is uniquely giving off that we could start paying better attention to so that we could actually predict risk, diagnose, and treat disease as it manifests in people with female bodies. But excited to have this conversation with people who all understand the challenges that we're going through.
Yeah, I was just going to say, I think your journey is one that many can relate to. And I appreciate you sharing and giving this insight. And Katie, I'm going to pass it over to you to introduce yourself.
Sure. So thanks. And hi, everyone. I'm Katie Schubert, and I'm president and CEO of the Society for Women's Health Research. And we are based in Washington, D.C. We will be turning 35 years old next year. According to everything we're reading, I guess that means we're entering our midlife. But we were initially founded to advocate for better, broader, and more inclusive funding for women's health research, more sustainable funding for women's health research across the spectrum. And we really do that by looking at anything that differently, disproportionately, or uniquely impacts women. And so I will definitely get to that in just a minute. But our mission is really to advance women's health through science, policy, and education, and then promote research on sex differences. So not just the disparities we see amongst women, but also the disparities that we see between women and men, and how we're making those medical and clinical decisions based on the information that we have, which is not the best information that we should have access to. My journey is a little bit different. It's a policy-based journey, I guess, which is sort of wonky. But I started my career on Capitol Hill 20 years ago. I worked for a couple of members of Congress in domestic policy, sort of fell into healthcare. Although I come from a healthcare family, my mom is a nurse and my father's a healthcare administrator. So I guess I couldn't get that far away from it. And really began to work with healthcare patient advocacy organizations, medical professional societies, was having babies myself at the time and seeing people around me really suffering in their healthcare and health outcomes as they were becoming mothers. And so did a lot of work in the maternal health space and then found my way over here to the society in 2020.
Thanks, Katie. So as you can see, we have a group of real experts on the call and both all have their personal experiences with the healthcare system and then are doing such important things to move the needle for all of us. And so I'd like to, Katie, kick it off with you. We discussed on our panel prep call that literally you could probably do a 3-hour plus presentation on the state of women's health research. But for the purposes of this call, if you could just maybe give us, a couple minute overview on the state of women's health and state of women's health research as you see it now.
Yeah, I mean, I'll start with the lead here, which I think the state of women's health research is relatively strong in that we are seeing a moment happening and a lot of momentum. But I think the challenge for us all, so my sort of plea to you all today is to help us turn that moment into a movement, because we really need to make sure that we are continuing along this journey. So Priyanka mentioned women were not included in clinical research in the US until 1993. There's a lot of good reasons for that, or good intent, I should say, for why that was. And really the issue was that researchers and policymakers were concerned that there would be birth defects associated with particular medication use, which we did see in Europe, and we did see a limited amount of here in the US. And I'm happy to talk to anybody about that and why that is. But what that ended up causing was this gender health gap that we see, right? So if women aren't included in clinical research, we don't necessarily know that the signs and symptoms of heart attacks are different. All of the medical guidelines are based on men, and frankly, white men of a certain age and size. And so we are really trying to play catch up in a variety of areas, but we do know that autoimmune disease, the patients are 80% women. We don't necessarily know why. We have some theories. The lengthy diagnosis that you've heard just a little bit on, I think, is not an uncommon story. I'm sure you all have experienced that as well. But we also look at things like obesity, bone health. Most osteoporosis patients are women. In fact, I fell off of a front step the other day trying to get out of my house, and immediately was like, oh my God, I've broken my ankle, and I now am worried about osteoporosis. I'm walking, I'm fine. I was being a little bit a little extra, but these are the things that we're concerned about, right? Menopause is also having a moment, but there's health risks associated that we know nothing about menopause. We couldn't even track maternal health and pregnancy research until a few years ago at the NIH. And so not to mention the fact that we weren't even looking at differences in male and female mice models until 2016 here in the US. So there's a lot of catch up happening, but I think there's momentum, and all of that is to say that in 2023, so last November, the Biden administration announced the first ever White House initiative on women's health research to address this issue. They called on Congress to support $12 billion of investment. That's not real right now, but we are working really hard to try to get there. But they have put almost $1 billion in of existing money through the Department of Defense, through the NIH, through the new research agency ARPA-H for high risk, high reward research. So we're seeing progress. I think we've seen more progress in the last year than probably we have in the last couple of decades, but we are getting there. So it is an exciting time.
Yeah, thank you, Katie, for sharing that. It is a very exciting time. And there was just an announcement, right, that it was another 500 million that was put in. Yes, okay.
So 500 million at the Department of Defense, 200 million at the National Institutes of Health, and 100 million at ARPA-H. So 5, 6, 7. So that's 800 million, which is not a small amount of money for the federal government. 12 billion was like super exciting and seemed like a whole lot. And I was like, oh my God, how are we going to do this? But we're getting there slowly but surely, and hope to convince Congress to do the same.
Thank you. It's exciting, and I don't feel like it's quite, Katie, you and I have talked about this. I feel like it hasn't gotten as much coverage as it should in the news. And so I don't think that everybody always knows that this is happening. And so I'm excited that you've been able to share that with us today. So I'd like to now transition and talk a little bit more about what Ellen and Priyanka, each of you, are working on, because again, you're also really helping move the needle in women's health. Ellen, we know that over 80% of people living with autoimmune diseases are women. And so want to hear a little bit more about how does this impact the care for autoimmune patients, and how are you supporting this at WellTheory?
Yeah, definitely. I mean, to your point, autoimmune disease is really a women's health crisis. There are certain conditions that are 16 times more common in women, but I think what's interesting is that despite this disproportionate impact, I don't think we often think about autoimmune disease as falling within, the women's health category. And my theory is this is because autoimmune disease doesn't really neatly sort of fall into a woman's life stage, right? Unlike, menopause or reproductive health. The onset of autoimmune disease really happens across a woman's life cycle. We largely see it around big hormonal shifts. So, puberty, postpartum, menopause, et cetera. And so at WellTheory, we're often seeing women really across a wide range, just in terms of age, just because of that phenomenon. And I think a lot of us have touched on this, but the unfortunate reality is that women and minorities are less likely to really be believed in their healthcare journey. Their symptoms are much more likely to be minimized or really brushed off as being psychosomatic from the outset. In the case of autoimmune disease, right, it takes 5 doctors on average over the course of 4.5 years to even get a diagnosis, and almost 50% of autoimmune patients are labeled as chronic complainers during their diagnostic odyssey. So as we were starting to build WellTheory, we really wanted to bridge the gap that exists in the standard of care today and really intentionally design the experience to support our patients who are largely women. I know we've quoted the 80% stat. I think our membership is probably 90% women, so skews even slightly higher than what we see in the population. But I would say this manifests for us in a couple of different ways. I think first and foremost, I touched on how a lot of autoimmune patients are often having come from, having their symptoms dismissed in sort of the current medical system today. And at WellTheory, each member starts out with an in-depth 60-minute onboarding session. That's 4 times the length of your typical primary care visit, right? That really deep dives their health history and also looks at them holistically, the food they're eating, their sleep, their stress, their relationships, how they move their bodies, so many different elements just to put together this really personalized care plan. And I think what we hear from our members time and time again is that this is often the first time they feel like they've been listened to, heard, and oftentimes believed in their healthcare journey, which to me is always, it feels like the bar is very low, right? And at WellTheory, we are really built by autoimmune patients for autoimmune patients. So, just given our mission, a lot of folks have lived experience that are, attracted to that. And given the odds that we've talked about, that means that our company and also our care team members are largely women. So as women, we're really designing the experience that many of us wish we had earlier on in our own health journeys. And I think what we hear from our members time and time again is that it's really important to have providers that they feel like they can relate to. And again, like I mentioned, because of our mission, we tend to attract providers who have lived experience and have really been in their shoes before. And then I think really quickly, the last point I'll mention is just, it's an incredibly lonely journey, not only to get a diagnosis, but also it can be really isolating to make changes to your life and lifestyle that maybe your friends and family aren't following. And one of the key foundations of the WellTheory offering is our community. So that includes both asynchronous forums, but also live events that are facilitated by our providers. And I think what I found in my own experience is that it really takes a village. And oftentimes, community and connection can be a really important part of the healing journey as well. And so at WellTheory, we're really providing this community so that our members can connect with other like-minded women who are going through a similar experience, very similar to what you're cultivating, Lilly, and also just feel less alone in their journey.
Thanks, Ellen. And, you touched on so many critical points here, and just something that we do hear time and time again in the collective, in my work with the Autoimmune Association, is just women are not believed and their pain is dismissed. And so I'm sure that what you're doing is incredibly validating when people come and find you at WellTheory to say, yeah, we get it, we believe you, and we're here to help, and we're going to take a different approach. And so I think that's incredible. I wish I had it when I was diagnosed. I was in and out of the ER 3 times in one weekend with this unbelievable stomach pain, unlike anything I'd ever felt before. Couldn't even swallow water without feeling pain. And they sent me in and out of the ER because they thought it was all in my head. And then turns out they found bleeding ulcers in my small intestine and diagnosed me with Crohn's disease. And I have just met countless women in my, as I'm sure you have, Ellen, and you have Priyanka, and you have Katie, who have a similar experience. So there's a lot we need to do to change that paradigm. And Priyanka, and I see you nodding your head and in total agreement, and you're doing some really incredible work over at Evvy too. I will say I'm a huge fangirl of Evvy. I use your kits to test my vaginal microbiome. It's been a game changer for me because it's something that I've struggled with, and I know that many other women, especially women living with chronic conditions, struggle with. So you're really helping folks understand the vaginal microbiome and vaginal health, which has long been underfunded, understudied. And you're revolutionizing it through these innovative diagnostics. So can you tell us more about what you're doing at Evvy and how you see the role of data and personalized medicine transforming the way women's health is understood and treated?
Totally, definitely. God, it's resonated so many things Ellen said too. It's just so exciting to finally see things changing, and it really does give you hope that, like, when we have kids, that maybe they won't have the same problems that we did. But I touched a little bit on this. I think my driving force was really the data, the gaps that existed on the data and research side of women's health. And one thing I didn't mention in my intro is that my background, similar to Ellen, not from healthcare. I come from a background in working at machine learning, AI data companies. And so I think it was especially shocking to me to live in a world where we were saying how we could predict anything and build models that could do anything. And then if it comes to the female body, everyone was like, hands up, like, I don't know, right? Drink water. And I just couldn't believe that we didn't have those data sets. And as Katie mentioned, like, obviously, if you haven't done the research, how are you supposed to have the data? And without the data, how are you supposed to change medical guidelines? How is the experience that we get at the doctor's office supposed to be any different if doctors don't have the research and the data to be trained differently? And so our focus at Evvy is just like, how do we build that data faster? How do we do that do that research faster? And I think, frankly, for better or for worse, I think the people who are the most driven to change the system are the people like us, right? Are the people who are actually dealing with the conditions. And I always say, like, women are the people who are going to change the healthcare system to work for women, because frankly, we're the only people incentivized to do so in the unfortunate reality of the way that our system is designed today. And so our focus, like I said earlier, is to really discover and leverage these markers that the female body is uniquely giving off, right? Like, I always joke that our bodies are probably constantly trying to tell us where things are going well and where we need help. And I just imagine these, like, listen, please listen to me, but we're just not listening because we don't measure or track those signals, because they were never shown to be predictive of a state of health or disease, because we only studied men, right? And as you heard from Katie, particularly like middle-aged, mid-sized white men. And then we like kind of assumed women were smaller and we could just like make healthcare work for them. And obviously we all know that's not working. And our first set of biomarkers that we're focused on at Evvy is the vaginal microbiome. And I think there's kind of two interesting sides of the vaginal microbiome to understand. The first is probably something that many of us have dealt with ourselves, right? Which is vaginal discomfort, vaginal symptoms, vaginal infections. In the US, vaginal discomfort is a leading reason that women seek healthcare advice. It's the #1 type of OBGYN appointment. 30% of women at any given time have at least one vaginal infection. So it's a wildly prevalent condition. And so if you are someone who's dealt with those conditions, as much as there is shame and taboo and stigmas around these conditions, they are so, so prevalent. And what's so unfortunate is that when we go to the doctor today, we are more likely to be misdiagnosed than correctly diagnosed, and we are more likely to not get better than we are to get better. So you basically have one of the most prevalent conditions that affects women that is being entirely mismanaged by the healthcare system today, right? And that's obviously, no doctor wants to provide that. It's that, again, they don't have the tools or the data or the ability to give women a more precise diagnosis, or to give women the correct diagnosis, or to give them treatments that are likely to work. And obviously that comes back to a large kind of overgeneralization of what's going on in the vagina, as is true in so many conditions in women's health, right? We have an advisor who always says that, when there was cancer, it was an unsolvable disease. And then you got to lung cancer, which was still an unsolvable disease. And then you get to the specific mutation of the specific gene, and like that becomes a solvable problem. And I think so many things in women's health continue to live at that kind of cancer and lung cancer level, right? Why are only women's health conditions, do they end with the word syndrome, right? Like, it's because we just haven't actually evaluated or discovered what the problem is. And we're really trying to do that in vaginal health by actually using comprehensive testing to look at what's going on, so that we're not just diagnosing everyone with these extremely broad brush infections. The second half of what's interesting to know about the vaginal microbiome is the role that it plays in women's longer term health outcomes. So essentially, long story short, is that the vaginal microbiome plays this interesting kind of like barrier role for the rest of the reproductive system. And, I'm trying to think, simple explanation of this is that essentially when you have healthy or protective bacteria dominating your vaginal microbiome, they're making it an inhospitable environment for pathogens, meaning that, your vagina is an open canal between the outside world and your reproductive system. Things are going to get in there. And the goal is that they can't survive or replicate. And it's actually the vaginal microbiome that's ensuring that that can't happen. And what happens is when the vaginal microbiome breaks down, because God forbid you have sex with someone new, or you sit in your swimsuit for too long, or you have a long period, all of which can kind of elevate your vaginal pH, that's when those pathogens are able to replicate. That's when we go to the doctor with these symptoms and infections. But what we're not paying attention to is the way that that also can then increase your risk for everything from IVF failure to preterm birth, to cervical cancer progression, to STI acquisition. And it just blows my mind that for the number one reason that women are at the doctor, and for something that's playing such a large role in so many negative, expensive health outcomes, there had just never been large-scale data. And so that's what we're focused on. First at Evvy, we offer an end-to-end precision vaginal healthcare service. So we do, as you mentioned, Lilly, we have an at-home metagenomics-based vaginal microbiome test. So we brought whole genome sequencing to the vaginal microbiome in a clinical setting at scale. We're able to look at everything that's going on, give much more precise diagnoses, and then actually prescribe custom compounded treatments with the ingredients that are most likely to help each individual patient, right? Like, how are we supposed to have precision medicine for women if we don't have data? So we very much started with, let's build the data around these biomarkers in these areas so that we can stratify disease, we can predict the right treatments, and then we can bring that to patients at scale. And last thing I'll say is that through that platform, we've now built the world's largest and most comprehensive data set on the vaginal microbiome ever. And so now we're doing a lot of really exciting work on how we can leverage it to improve outcomes, both in vaginal health, but then in other areas of women's health as well.
Thanks, Priyanka. So exciting what you're working on. And let me know, folks, if I'm freezing at all. I got a notification about my internet that it was a little unstable, so I'll work to correct that if needed. Okay, so Katie, I'm going to kick it back over to you. When we think about the future of women's health research, it really requires collaboration across different sectors. How do you see industry, research, and advocacy groups working together to create this lasting change?
Yeah, I mean, we absolutely have to all work together toward the common goal. I think if the way that we've sort of been doing this over the last 30, 50, 100 years was working, we wouldn't be having this conversation right now. So I don't think there's a lack of willingness to work together. I think we just have to think about new and innovative ways to get to the goal that we need. I see it happening every day, right? When we think about what Priyanka and what Ellen were just talking about and the need for data, like there are people coming out now who understand that this is a challenge. They're not satisfied with working with the status quo because that isn't getting us anywhere, and to really make sure that we have answers available for women who need them. So I think that's one piece, is we've all now identified that we have this common goal. We know what we're working toward, but I think we can do that in different ways. So at least from the industry side, I would love to see like big pharma and medical device companies working or sort of taking a cue from some of these startups, that women's health is all health, and it shouldn't be thought of as a niche market. It should not be thought of as something that's special or small or not important. And I do think we're seeing that when we think about the movement toward more diverse and inclusive clinical trials to start, but also as recognizing women as consumers. I jokingly say, like, all you have to do is look out of my front door and you will see what a great consumer I am from all of the Amazon boxes that I have out there. But we're making the decisions, right? Like, we're the chief medical officer of the family. We're making all of the medical decisions for our families, our parents. We're engaging in that conversation with friends. So I think that's one piece on the industry side, to really think about how some of the larger companies can kind of come together to advocate and to do better on their own and learn from the groups that are doing it well. I think on the research side, there's a lot of education and awareness that probably needs to be done. I would add that into medical education as well. Researchers aren't necessarily learning how to look at things like sex differences. That's not how they learn to do research. Hormones are really difficult to control for, so they are engaging in trial design or study design that's easiest to be able to control for one thing. And that's just not the reality of what we see when we look at chronic conditions and disease, right? There's multimorbidities, there's changes in hormonal fluctuations in women in particular, but there's changes in hormones for men too. So I think that's one thing that researchers could be looking at to be really advocating for. How do we better equip the researchers to be able to look at these differences and analyze the data, right? They may have the data, but they're not analyzing sex differences data for sure. On the medical education side, the unfortunate reality is that even if you are in OBGYN and women's health, you probably didn't learn a lot about, if anything, about something like menopause. So we're really at a loss, I think, in terms of our medical education, that our clinicians are not learning from the beginning how to think about women's health. That's part of the reason why these lengthy diagnoses, are happening. They're not recognizing what's going on immediately because they probably never learned about it. So we need to be doing better there. And then I think, from the sort of public health advocacy side of things, right? Like all coming together for that common goal, engaging folks who are here today, right? Like write your members of Congress, tell them to fund women's health research, tell everybody to kind of come together and really make this a priority, because we are in a public health crisis. We are in a women's health crisis. And that can look like a number of different things. It does not necessarily look like a solely reproductive health issue. It is across our lifespans, and we need to be doing better. So there's definitely a role for all of us, but we have to be working toward that common goal. And I think we are. I would just love to see this groundswell, and again, this moment turn into a movement, if you will, moving forward.
Katie, this is so wonderful, and I couldn't agree more. I love that you're calling on this group of women to make a push to address this women's health crisis that we're in. And we are getting folks asking if there is a template we could use to send to our Congress people. So if you have one and you wanted to,
we'll share one. I would also say this too, and my disclosure, we're a 501c3. I don't care necessarily who you vote for, but I do want you all to vote. We also have a Get Out the Vote campaign that's specific to women's health and research. So I'll put that link in the chat, but I also am more than happy to create. I think we have a bunch of different templates, but I'll find the link for that too. I don't have that one quite handy, but we'll definitely give it to you, Lily, so that you can share it.
fantastic. We will absolutely share that post-event to everyone who's attending the summit and folks who are watching the recording back, because we need to we need to push, and it's our voices that make an impact. All right, I want to transition now to Ellen and Priyanka and talk a little bit more about your entrepreneurial journey. And we have a lot of folks who are part of the summit and part of the Chronic Boss membership who are entrepreneurs or aspiring entrepreneurs, many of whom are working in the women's health space. And so what is your advice to these women who are looking to make an impact in the women's health space, and what obstacles should they be prepared to overcome? Ellen, I'll start with you. Yeah.
Okay. I'm going to jump in first. So you've heard a lot about our own personal experiences, as women in the healthcare system. And I would just say that your personal experience and story is one of the most powerful assets that you have. And I found this to be true both internally in terms of my own mindset, but also I think externally as well. I often joke that if I wanted to just start a successful company, then it probably would have been a different space than healthcare, just because healthcare is so slow moving. It just takes so much time to affect change. You get so many no's, this will never work. How many people are actually impacted by this? This is just a niche thing. And I think for me, what's helped me to really stay resilient and bounce back amidst all of that is just reminding myself that, the version of me 5+ years ago who really desperately needed the solution that we're building today. And I think a lot of my personal motivation comes from not wanting to have another person go through a similar experience to what I did. And so I think that's what really gets me out of bed in the mornings when the going gets tough. And I think the reality in healthcare is that you often just need to be persistent enough, long enough for something to really happen. And I think that's true on the business side as well. I think not only does it help you build the best product and experience because you are often your own user that you're building for. Obviously, it's important not to fall into sort of this N of one experience, but I just think when you have that deep empathy and lived experience, it helps you to just build, so much more of a just better consumer product and experience. So And then I think for me, I'm very external facing. I'm often pitching, employers and health insurance companies to, cover WellTheory as a benefit. And I think I've seen that in those presentations, my story and our mission really helps to attract other like-minded folks to us. So, I start every presentation by sharing my personal story because, that's why we started the company. And also I know that 1 in every 6 Americans is affected by one of these conditions. So the reality is that there's likely someone on the line who knows someone who's been impacted or has gone through a similar experience. So what I often find is that they may not remember exactly how our service works, what the pricing is, et cetera, but they always remember my story. And I think it really makes sense when you think about it from a psychology perspective, right? As humans, we're really wired to communicate in stories, and we really gravitate towards others that we feel like we can connect with on that level. So I would just say my advice is really lean into your personal story and experience, both from a sort of internal mindset perspective, but also externally. And yeah, I kind of spoke to some of the obstacles in healthcare. I think a lot of it centers around just the bureaucracy and also how much time it just takes to make anything happen. And I think it makes sense, right? You're dealing with people's health. So the stakes are really high, but I think working, especially with payers and employers, just requires a lot of patience and persistence. So I think a lot of it is just keeping at it and knowing that, again, if you're persistent for long enough, eventually you'll break through.
Yeah, Ellen, great advice. And I'll say I echo that. And for those of you who attended the Chronic Boss Building Block session, our first session of the summit, it's something that I talked about, right? People do relate to people. People remember stories. We can all list off a bunch of facts and statistics, but at the end of the day, when you tell your story, that's what people take home with them. That's what they remember. And this is also, of course, and Katie, I'm sure you would echo this too. This is really important when you're reaching out to congresspeople and you're trying to advocate for policy changes, sharing your story, because that's really what resonates. So Priyanka, same question over to you. Would love to just hear about your advice for fellow entrepreneurs in the women's health space.
Yes, I think I actually have a similar one, Ellen, just maybe phrased slightly differently or from a different angle around like, I think one of the things that was really hard for me was that I am not a doctor. I'm not a PhD. I'm just like, whatever, fill in the blank of like, whatever you want me to be the founder and CEO of Evvy, and like, whatever it is, it's probably not me. And I think that was particularly hard. I think when I was initially coming up with the idea, everyone I had read obviously every paper on the vaginal microbiome. I probably knew more than the average doctor or scientist in the space, but like just not having the degree letters after my name, it was just like really hard to get people to take me seriously. I'm also a younger woman. Ellen and I went to Stanford together, and it was like Theranos had happened, and like, how could another woman from Stanford start a testing company? Like, it must be a fraud. And so I think that was all really difficult. And I think kind of trying to come to terms with like, what is the asset that you bring to this, even if you are not the doctor or you're not the scientist. And I think, Ellen, exactly what you said was so perfectly said, which is like, actually the fact that you are a patient who demands for this to be better is an asset that you bring to the table. And your job is not to be the expert. It's to bring the experts to focus on this problem, and like becoming comfortable with saying like, I'm actually the best person to rally the resources to get these doctors and these scientists who could be doing anything in the world to choose to focus on fixing this problem. And like, that is actually an asset that I am lending to this company. And like, coming to terms with that, I think took me a long time. I would say other pieces of advice generally are that like, honestly, as much as of course our personal stories matter and the emotion and the morality of the fact that women's health is a shit show all matters, I also think that like grounding everything in the numbers is so important, because at the end of the day, like if you're trying to start any type of business, like you have to make money, right? And like, you have to make more money than you spend. And so I think like coming back to the fact that like these areas are actually massive areas of opportunity, and that the fact that they've been overlooked and stigmatized is actually what makes them these large opportunities, right? If they weren't stigmatized, if they weren't overlooked, then everyone would have already been in these spaces, right? And so I think the advice is that, one, you have to be way more patient than you think you have to be around education. And I think that, to your point, Katie, people are there is a moment right now. People are willing to listen. People are saying like, okay, I've heard something about women's health, or I've heard something about menopause, or I've heard something about autoimmune disease. And they're giving us that moment to listen. And I think what's hard and frustrating is like, why should I have to spend my time educating you about this massive problem that affects most people? Like, it doesn't feel like that should be my responsibility. But unfortunately, it kind of is. Unfortunately, it is a little bit of our responsibility if we want to change it. And I think what we have found is that when you're willing to do that education, you let people ask you the dumb questions. And I think then you kind of start to show people these massive opportunities that sit behind these stigmas. And I think when you're able to put the numbers behind it and you have the personal story, I think together it's actually like an amazing, amazing time to be solving these massive opportunities. And frankly, we need people who are not just the experts to demand better solutions. We need the consumers, we need the patients, because we're the ones that are going to demand the experiences that we all wish we had.
Priyanka, so beautifully said. A lot of great pieces of advice in there. And when you were first, that first piece of advice you were sharing, it really reminded me of the conversations folks have been having around and how rampant imposter syndrome really is, especially for women. And what I always say to women, especially female entrepreneurs, is if you're feeling imposter syndrome, that's a good thing. That means you're up to big things and you need to keep going and you need to embrace that feeling because we need you to bring your gifts to the world. So anyways, I loved all of this advice. It was wonderful. Thank you so much. I want to give a chance to open this up to folks for questions. And then I do have one final question. So feel free to drop your questions in the chat if you have any. All folks are thinking, I love this comment from Sally. By this question is always mind-boggling, given we are half the population. Yeah, I would agree.
Yeah, I know. I mean, it's just one of those things, and to Priyanka's point about like being patient, I think we really have to think about where we came from, which was no woman in the room who could make a decision, right? Who didn't have the power to make a decision on whether or not people were included in trials. And no one who was able to really push back at the time on this idea that women are just little men, right? And so now, and I was just talking about this earlier this week to some data folks, like, think about who's not in the room and think about the questions that do need to be asked, and make that just like a general protocol for any meeting that you're in if you're talking about the data in this case. But I mean, I think that's just good advice anyway, to just think about like what voice is missing. And I think if that question had been asked, we probably wouldn't be having this conversation. Or if we understood a little bit more, it's just that there were a lot of societal and historic inequities and structural issues that have to be, and still have to be, quite frankly, overcome to be able to do it. It's just that now we are using this collective voice to be able to make that change.
Yeah, it's a great point, Katie. A question came in from someone focused on studying hormones and the effect they have on the human body outside of reproduction. I don't know if you guys know the answer to that.
This is definitely something. Oh, yeah, you go ahead, Katie. You go.
No, go ahead. I'm happy to follow on.
Okay, I will just add that this is something we're actively looking into. I think one of the challenges with hormones is that, and probably everyone on this call knows this, the tools that we have for measuring hormones are still, unfortunately, subpar. And Ellen, I'm actually curious what your thoughts are on this from an autoimmune standpoint. I know I looked at a lot of this personally, and I'm actually so curious to do more research on like how we can unlock some of these more novel testing methodologies to better measure hormones. But I do think one of the reasons that we don't fully understand how hormones are affecting even our reproductive health, to be honest, let alone the rest of our health, or menopause, et cetera, is because we just don't have great ways of measuring it reliably. Like there are still not fully agreed upon ways to measure hormones, which is wild. And I think speaks to everything we've been saying today.
Yeah, just building on that, we do at WellTheory, we do offer specialty labs to look at some of these underlying root causes, including, you know, hormones, which obviously are such a big part of the picture with autoimmune disease. Like I said, a lot of I think Katie mentioned this before, we don't really know exactly why autoimmune disease disproportionately impacts women, but we do tend to see the onset of these conditions around these big hormonal shifts. But building on what Priyanka shared, I think we also have some of these labs that aren't always covered by insurance. So oftentimes you're paying hundreds of dollars out of pocket to get a a deeper look at what's actually sort of in the optimal or functional range versus just sort of the very cursory, like looking at your hormones at a moment in time. The reality is you need to look at it, across 24 hours a day, right? Because your hormones change. It's not just a fixed point in time. And so that's a lot of what we're trying to do at WellTheory, which is get more adoption and coverage of these types of tests by both employers and also insurance companies as well. Because I think as consumers, we're really demanding this and we want to understand what's actually going on in our bodies.
Yeah, I mean, I think from a federal research perspective, as part of the White House initiative, this is something we are going to see coming. One of the things that we at the society have been advocating for is like to think about how do we fully understand the effects of hormones, and again, over time and outside of, but also inclusive of reproduction. So we want to look at it all. But I think one of the opportunities we have right now is to take this conversation surrounding menopause and why we see greater health risks for certain chronic conditions during that time. It's related to your hormones, right? Like it all is. So really being able to funnel some of those federal funding opportunities into that space. I think the reality is that, this was not something that was as attractive for private investment up until fairly recently. And so the only investment that there was really being made was at the federal level. And we couldn't even track that type of research until this year. So because menopause is not a disease, right? And hormones are not a disease. It's just, we have to figure out the right way to track that over time. But it has been identified as an area of need through the White House. And it is the DoD funding that we mentioned earlier is looking at that time in a person's life. We're really seeing a lot of, again, momentum. I hate to just keep using that word, but we're seeing this conversation happening in different places. And I think, and I hope over the next year, we'll see what those funding opportunities are looking like so that we can make progress there. But it is interesting. And I love that you brought up, like, you have to track this over time. I don't know about you, but like every time I go to the doctor, I'm like, there's something going on. Please take my hormone level. Like, I have a thyroid issue, whatever. Like, and it's everything comes up negative and normal because it's one point in time that you're looking at, right? But we really need to be tracking and looking at the interaction and really learning at the most basic level, like, what does that mean? What does it mean for your heart health or your bone health or autoimmune? Like, I feel like there's so much there that is untapped right now.
Totally. I mean, the only thing I'll add is one just very tangible way we know that hormones impact our bodies is actually our vaginal health. Like there's a huge relationship between levels of estrogen in the body and then actually what happens to the vaginal microbiome. There's like estrogen produces glycogen that feeds the healthy bacteria. And actually the leading symptom of menopause is GSM, which is vaginal symptoms often related to the decrease in estrogen. So I think in these kind of specific pockets, we're starting to learn those. And I'm hoping that as more companies like Evvy start to exist, we start to flush that out. And the only last thing I will add related to what Ellen, you mentioned is I think one of the biggest challenges in women's health, and there's actually an amazing doctor people should follow who talks a lot about this, Dr. Jocelyn Fitzgerald, I think is her name. And she started something called Gyne Economics, and she basically outlines how women's health conditions are actually systemically poorly reimbursed, meaning that tests, as Ellen mentioned, so tests that are more likely to be useful for women, things like the Evvy test or vaginitis testing or hormone testing are systematically, like there are just not CPT codes that you can bill for those tests. But then also that the same procedures for women and men reimburse more money to the doctor for performing the procedures on men. So like just how the layers, the depth to which this problem persists just continues to blow my mind. And I think plays a large role in why we don't have more accessible testing and services.
Oh, that's
my
such
gosh,
a
it's
you.
yeah.
I mean,
It's
it's like
infuriating. Following
just to
her on
add,
Twitter
like,
is
when
crazy.
it definitely follow her. This is such an issue, and it's an issue that we use uterine fibroids or endometriosis as a huge prime example of this, because the surgeon gets paid the same amount of money no matter how long the surgery is. So oftentimes they will get in there and instead of removing as much as they can, might do something that's less and not helpful to you or close you right back up because they're not they're spending hours and hours and hours, but they're not getting paid for that time. And so I know that's something that we've looked at, and the American College of OBGYNs is aware of. Those structural changes take a lot of time, but it is like the perfect example of those layers of institutional, like structural issues that we are seeing about why we are where we are. It's so frustrating.
Yeah, Jocelyn, we did a panel together and she told me a story of how she did a biopsy on a vulva and a penis, and the one for the penis was reimbursed 4 times higher than the one on a vagina, even though it's like, she was like, arguably the vulva one is way harder.
These problems are so systemic and so rampant, and it's scary. But it is encouraging to hear, I think, when we think about like hormones and the original question, how much is happening, that there is something happening now. Maybe there wasn't as much before, but there is a movement for more to happen. And Katie, somebody commented in here, they're loving this discussion and ready to help turn this moment into a movement, which is great. And I'm seeing a lot of people just agreeing in the chat and saying, yes, like we need more of this. And there was a question that I think was, and I can't even find it out. Oh, what is the best way for us to educate ourselves on different facets of women's health? Because, Katie, she said, I feel that my own education on women's health could be better. And I think that's the case for a lot of us, because even in all of the work that I do, right, and probably for a lot of you that you do, nobody ever even says vagina. I don't hear people. It's almost like
I know,
a dirty word,
Yeah.
right? Like they don't say vagina. And so like, what are the resources that you think folks here can go to find support and more information?
Yeah, I mean, I think you could go to each of our websites, right, to find a lot of information. I know from a SWHR perspective, we have a lot of info for if you're dealing with particular conditions or issues. Menopause is like such a hot topic, haha. Right now, but we have like a women's empowerment guide. It'll walk you through symptoms, potential treatments, what to look out for, how to have these conversations with your clinician. We have those in lupus, fibroids, endometriosis. We have 2 on migraine. Like, go to our website and check it out, because all of that is there, and they're all materials vetted by our interdisciplinary working groups. And we have folks who came together who are not just researchers, but also clinicians and patients, and in some cases insurers, to like, how do you navigate this? So we have a number of things coming also down the pike in terms of that side of the conversation. But the biggest thing I would say, and I can see some of this in the chat, if you're not being listened to or heard by your clinician, no matter how much you like them, right? They could be your best friend. Go see somebody else who will take your concerns seriously, even if it is just, oh my gosh, I've gained so much weight, I'm doing all the same things, this is so frustrating. And you're just hearing like, drink more water and like go for a run. That's not, I don't know, this is a personal story, right? Like, that's not the answer to this question. So you have to sometimes be able to, and unfortunately that burden is on us. I hope that one day it will not be on us to do this, but you have to be able to just say, this is not a good place for me, and find someone who will listen to you. There are so many more clinicians out there these days who can listen to you, who will get you the answers that you need, and who will take you seriously. And that's your right.
Amen. I mean, things I would add to that, I love everything you just said. These are not 100% vetted channels. So I will say the I would definitely look at the Society for Women's Health Research website as well. But I will also say that like companies like Evvy and WellTheory, honestly, and Ellen, I don't want to speak for you, so correct me if I'm wrong, but so much of, frankly, our marketing and growth strategy has to be education. And so we've all invested. And I think like I would love for somebody to do an analysis of the percent of dollars that women's health companies spend on education compared to the average company, because I think all of us radically overinvest in that area, because actually what's happening is that because we're not being answered by our doctors, we're turning to Google. And so actually as a brand, it makes a lot of sense for us to make really good content that answers your question that shows up on Google. So like as a business, it makes sense for us. But because of that, we've all invested in bringing together scientists, doctors, et cetera, to answer the key questions that women have, because it's actually like one of our strong growth strategies. So I would say that looking at like a market map of women's health companies, looking at the areas that you're interested in learning more about, and then looking those companies up, looking at their blogs, looking at their social channels, I would guarantee you that all of us have really invested in education in like user-friendly ways, whether it's videos or blog posts, et cetera. And then I would also say if you're interested in just more broadly learning about the gaps that we've talked about, obviously the Society for Women's Health Research is a phenomenal resource. Evvy's runs campaigns where you've donated money to the amazing work they've done. But also every year, Evvy runs a campaign that we ran with WellTheory this year as well called Equal Research Day. And the whole concept is to raise awareness and funds for these gaps, exact gaps that we're talking about. And we partner with over 50 women's health companies to do so. And wow, someone just put that in here. Evvy, we did publish a book this year on the 100 FBAC. So if you want like a really good coffee table book that both gets you really angry and starts good conversations, we do that and we donate the money to organizations like Society for Women's Health Research. And the last resource I would point to, given that we are, 34 days away from an election, is there's also an organization called the Women's Health PAC, which is the first ever bipartisan PAC focused on supporting all candidates that are focused on improving access and services in women's health across the political spectrum. And so they put out a lot of great content, information on how different candidates are talking about different women's health issues. Obviously, abortion is a key one, but it goes far beyond that as well. So I think that's a great resource to look at as well.
Oh my God, so many amazing resources. I am overwhelmed. I'm gonna have to go back and like read through all of this, and we'll consolidate all of these resources and share them back with the collective and perhaps in a blog post after, because this is just so important. Ellen, did you have anything you wanted to add?
Yeah, I think just building on what Priyanka shared, we've also invested a lot in building out evidence-based content on our blog, because we know, our patients are looking for that information and maybe aren't finding it. I know someone in the chat mentioned something about, their rheumatologist not talking about the impact of, triggers like diet, et cetera. And so I think for us, to Priyanka's point, just education is really paramount. And part of our mission is just empowering our patients to be able to really take control of their health. And the unfortunate reality is oftentimes you have to kind of take your health into your own hands. But we really want to empower people with that education and information. So I'm not going to add on there a bunch of wonderful resources that were shared. Definitely I'm going to do some of my own homework as well. But yeah, just agree with Priyanka that I think just that empowerment and education is super paramount for a lot of companies like us.
Yeah, thank you. Thank you, ladies. This is so many amazing resources. And thank you, Priyanka, for dropping the book in the chat. So just to close here as we wrap up, I think we could keep talking for hours. Would love to just hear from everyone. What is your hope for the future of women's health research? And I'll start with you, Ellen.
Oh gosh, so many hopes and wishes. I mean, I hope in the future that, women are not told that their symptoms are all in their head. Unfortunately, we've heard that numerous times in the chat and in conversations today. My hope is also that women's health means more than just reproductive health. Obviously, reproductive health is so important, but we've talked a lot about a bunch of different conditions really that span across a woman's life cycle. And so that obviously includes, a lot of what we've talked about around sort of, doing research on, patients who are actually affected by these conditions, understanding the sex-specific differences, et cetera. And this is probably maybe unsurprising and a little bit in theme with your previous question around sort of the entrepreneurial avenue, Lilly. But I think my biggest hope for women's health is that we have a lot more female-founded, patient-led companies. I really do believe that the future of healthcare is going to be largely driven by patients, especially women who've experienced their own significant gaps in their own health journeys. And I think as patients, we really are the CEOs of our own conditions in many ways. And I think once you're really exposed to some of the systemic, gaps that exist in healthcare firsthand, it's really hard to unsee that. And so, at WellTheory, I'm really building the experience again that I wish I had earlier on, but also the experience that I want today as an autoimmune patient. And I just hope that we'll see many more female-founded, patient-led companies in the future with women who are tackling gaps that they've experienced as well.
Beautifully said. Priyanka?
Oh, I agree with all of that. I think one, just doubling down on like women are more than our ability to reproduce. And I think that like so much of women's health research, conversation, private and public funding has gone to fertility and pregnancy. And as we said, and I would add menopause to that list now. Obviously, all of these things are very, very important, but there's so many things that affect our quality of life as women that do not get that same attention and investment. So I would echo that one. Second one is just like more research in the actual, more funding going towards research and data that actually helps us unlock a better standard of care, right? Like I think there's a lot of work going on to increase access and experience of care, but fundamentally, like we still can't get the best care because the research doesn't exist to underlie that. And I feel like my most fundamental hope is that like as women, when we have symptoms, we can get a diagnosis, we can get a treatment that works, and then we can go back to work, right? Because like what the world needs is all of us contributing to the workforce. And I think today it's unfortunate how much we just can't even get the right diagnoses and treatments. And fundamentally, that's what I hope better data, better research, better access, and better experience will unlock across the spectrum.
Couldn't agree more. And Katie, I'll give you the last word.
Ooh, I feel like mine encompasses all of these things, which I completely agree. My hope is that I get put out of a job, right? So I would love to see our vision of making women's health mainstream come to fruition, because if that happens, then all of these things that, that Ellen and Priyanka have been talking about are happening, right? We have the data, we have the information, people are learning what they need to know, we're all empowered in our care. And then it really just, it wouldn't even be thought of as something that's different or unique in any way. It's just baked into the system. So that would be my hope.
Amazing. Thank you all so much for generously donating your time and your expertise to this group. The chat was just going off the hook. People were like, this is resonating. It's making an impact. Thank you for all that you do and all that you're doing to close the gender health gap. And we look forward to staying in touch, and we will share all of these resources out that were discussed during the session. And we look forward to seeing all of you for our final session right after this, the Chronic Boss Info session. Thanks, everyone.
Thank you.
Thanks, Lily. Bye.